For over 30 years, the team at Hope Store New Beginning Center, along with our clients and community partners, have been building lives without violence in Dallas and Collin counties. If you're in immediate physical danger, please call 911. If you need shelter or would like to talk to someone about receiving our other free services, please call our 24-hour hotline at 972-276-0057 in English or Spanish. At Hope Store New Beginning Center, we offer free trauma-informed services for those affected by domestic abuse, battering intervention and prevention services for those who have abused their partners in the past, and free community education services for any community group or organization. Domestic abuse is a human rights issue that affects a third of all Texans. We empower victims, perpetrators, and community members to live in safety and foster healthy relationships. Please call our 24-hour hotline for help or visit hdmbc.org to learn more about our services. And don't forget to follow us on social media. Hope Store New Beginning Center, building lives without violence.
Thank you so much for joining me today. I see we have some people joining us through Facebook. I see we have individuals here in Zoom in attendance. Thank you so much for joining me today. Like I said, my name is Jose Romero. I'm the bilingual community education facilitator here at Hope Store New Beginning Center. And I'm just gonna throw it out right from the get-go. You're gonna see my head looking places, looking left and right. I'm keeping an eye in my chat, on my Facebook chat. I'm monitoring the Zoom questions that are coming in. And I see that, Kaylin, I got you, don't worry. And if you need CEUs for today's webinar, those are being offered. So we have those ready to go as well. So if you're joining us through Facebook, there should be a link attached to the event box there that can redirect you straight to our Zoom webinar. So if you need CEUs, that way we're able to keep proper documentation for those individuals that do need CEUs. But as well, if you need a certificate of attendance, please join us and send. I couldn't find. One second. So, and if you look through our Facebook post, it should have the link for our Zoom webinar. You should be able to find it through there. So it should have those attached under the event tab, so you can easily join through there. But again, if you need that CEU, but don't worry, and we'll get you sorted out. So don't worry about it. I see you're commenting through Facebook, but again, if you need those certificates, if you need that CEU, again, just leave your information down below, and we'll be able to get that sorted out for everyone who needs that. Okay, but as you saw in the little introduction video, briefly of what the Hope Store New Beginning Center does, what we offer for the victims of domestic abuse. We also have that BIP program for perpetrators. So we have various different things going on. We'll talk a little bit more about them towards the end. But I am part of the education department, and I go out into community and I speak with individuals, with students, with parents, and we talk about what domestic violence looks like. We talk about education services, what we provide, how we offer different opportunities for the community to get educated in that aspect. But our goal is to promote healthy relationships so we can empower the community and so we can help them understand, prevent, and respond to all the forms of abuse, because we know there are multiple forms of abuse. So we want to be able to help our community react to those, so we can stop some of that, so we can help our young men when they see some form of abuse going on in schools, so we can stop that in their tracks and help educate some of their peers in those type of situations as well. But what we're going to be talking about today, it's going to be essentially the intersection of domestic abuse and substance abuse. So what the connection the two have, because oftentimes we hear that yes, there's separate issues, but we know they can be co-occurring. So we're going to be addressing that and talking about that. And we're also going to be talking about the forms of abuse, because we know there are 6 different forms of abuse. So we're going to be talking about those and breaking them down a bit. And we're going to see what they look like when it comes to terms of in the side of domestic abuse, and also when substance abuse comes into play, what that might look like in a victim that is either suffering through substance abuse or where their abuser is the one that's actually the substance user. We're going to talk about the cycle of abuse from the perpetrator's perspective and from the victim's perspective, why the perpetrator stays and why the victim is forced to stay as well in situations like that, why someone would turn to substance abuse as well. So some of the warning signs, red flags of what substance abuse and domestic abuse will look like, and the importance of safety planning as well. And tied to that, we're going to also be talking about recovery plan, because again, when we talk about substance abuse and domestic abuse, we need to address that substance use as well. And that's where recovery plan comes into play along with that safety plan. And so yeah, these are the things we're going to be talking about today. We're going to try and break it down into smaller tidbits and hopefully not overwhelm everyone with information. So let's go ahead and get started with just a basic definition of what substance abuse is. And it's substance abuse is a disease that affects a person's brain and behavior and leads to inability to control the use of legal or illegal drug, medications, or substance. And we know what these substances look like. You have individuals that talk about the hard drugs, which would be IV drugs that they have to use when we're talking about heroin, cocaine, and those. But we also have the other medications, which are not substances, rather, which are for recreational purposes. And we're talking about your marijuana, we're talking about alcohol. So there's a difference between that legal and illegal substance, which can be abused in that perspective. But a lot of the times I get when I started doing this presentation for the first time, and I did it in person, one of the things I was asked is, Jose, why don't a lot of substance abuse facilities talk about domestic violence, or why don't a lot of domestic violence facilities talk about substance abuse? And this is coming from the client, from some of the individuals that were at a substance use recovery facility. And I had one experience that the first day when I gave this presentation, I had this one young lady. She was in the front row, and she was just looking through her cell phone, and she was like, I didn't address it because usually I don't like to put people on the spot when it comes to situations like that. But this lady, she was just going through. Anytime I switched to a new slide, she would write something down, and she would pull up her phone, and I could see her scrolling up and down. But I didn't make, like I said, I didn't make much note of it. But the counselor that was there, she briefly came up to her and told her, "Hey, put your phone away. Don't like you're being rude by just swiping through your phone while he's trying to present in front of you." And again, I wasn't making a big deal of it. But afterwards, when we finished up and I had wrapped up and everything, and I was about to head out, she came up to me and she asked if we could speak for a second. And she was just telling me, I didn't mean to be rude. I was just comparing a lot of the text messages, the emails that I was getting from my ex-boyfriend, and I was aligning it up to the presentation you were showing, because I didn't realize I was being emotionally abused. I didn't realize I was being financially abused, and she wanted to show me what the text messages looked like, so we were able to see, she was comparing her experiences with the information that I was giving her. And again, she told me that she had been at this facility, at this substance abuse facility for recovery facility, for about 6 months, and never had they talked about any forms of abuse. It was not in their agenda. That wasn't what they were there to talk about. That wasn't the resource that they were there to offer for her. So we know it happens. We know what substance abuse and domestic violence co-occur. It doesn't mean that just because there's substance abuse that domestic violence is going to occur, and vice versa, because we know there's individuals out there that use substances and aren't abusive towards their partner. And at the same time, we know that there are abusers out there that have never drank alcohol or have never used any sort of substance. So one doesn't cause the other, but we know that there is a linkage between the two when it comes to substance abuse and domestic violence. and it can be a tragically common pairing, just because, again, when perpetrators use substances and then they go into their little abusive behavior, they use that as an excuse for their behavior, and we know that's not the reason. And we'll talk a little bit more about that a little later in this presentation. But just like being a witness to domestic violence for a child growing up, as they grow up and they see that abusive behavior in their household, where maybe the dad is yelling to the mom, the dad is hitting the mom, and the mom is defending herself and she scratches back. Seeing that behavior normalizes that domestic abuse, and it's the same with that substance abuse. It can be normalized to a child seeing that their parents are using substances. So we know there's a connection there between the two, and those abusive situations can be tough on a victim. It can be very stressful. It can be very hard for them to cope with that situation. So at times that's where a victim feels like they have no other escape. So they have to use some sort of substance to help them escape for even a few hours. Just help them escape that reality that they're going through. So again, that's one of the coping mechanisms that a victim might use, that links the two together. But the one thing I wanted to stress, it while substance abuse doesn't make, or doesn't guarantee, doesn't make an individual become abusive, there has been connections just that show that the two go hand in hand. When I was speaking with one of our staff members, because I wanted to do this presentation, I wanted to touch on this topic a bit more. I was asking, out of the clients we work with, or that you've worked with, like how many of them have you seen that have been affected by some sort of substance use, either on their behalf or on the perpetrator's behalf? And they were telling me, out of every 10 clients they're working with, about 8 of them have mentioned that there's substance use in either the perpetrator side or in their side. So again, we see that there's a connection there, because we're constantly hearing that it's either the abuser or the perpetrator that has some sort of substance use, and that's not an excuse for that type of behavior. And again, we'll talk a little bit more about that here in a second. And what do substance abuse and domestic violence have in common? One of the most common things we hear often is it's that loss of control. I get aggressive when I drink, and I just lose control. And I beat my wife, I beat my partner, my significant other. I just lose that control, just because uh, the situation was stressful, and this is how the perpetrator was letting out that aggression. Or they drank alcohol, they used a substance, and it's that substance's fault that they turned aggressive. So it's a loss of control. And usually when I think of loss of control, I don't think of I had a substance and then all of a sudden I'm aggressive. No, loss of control, it's like that point of no return, when you're trying to hold in that sneeze and then you can no longer hold it and it's going to come out. It's that loss of control. That's what I think. Or when you're driving in the highway in the winter, and there's that, you hit that patch of ice and all of a sudden you can feel your wheels are just about to, they've lost control, and if you move that steering wheel, you're just gonna completely lose control of the car. That's what I think when I'm thinking about lose control. There's a difference between the two. um, Addiction and abuse tend to get worse over time as well. That's another thing they have in common, because when a perpetrator is being abusive and they're clearly getting away with it over and over, because maybe the victim is too scared to report the situation, that tells the perpetrator, okay, I can get away with this. Like, and the physical abuse or the emotional abuse, whatever form of abuse might be, is only gonna escalate in that form. And the same thing with an addiction, with a substance use dependency. If it's the victim that is dependent on that substance abuse, if that abuse is happening constantly and constantly, so the victim has to use substances more frequently to escape those situations that they're going through, they're eventually going to build up a tolerance. Just like any other medication, they build up that tolerance, and they're going to have to increase the dosage of that substance that they're using. And it's only gonna feed into that to that dependency, which is never a good thing. So that link that they have where it gets worse over time, we see how harmful that can be, and we'll talk about the harms as well that come from that dependency as well. Um, Continued behavior despite negative consequences. Again, perpetrators, the first when they abuse, it's often a repeated. It's being repeated. It's not the first time they've done it. They've probably gotten away with multiple times, and they know they can get away. So it keeps repeating. The same with substance use. If it's the perpetrator being the one that uses the substance, and they can use that excuse, well, it was the substance that made me aggressive, and use that as an excuse to get away with it, they're going to continue doing that. They're going to continue using that as an excuse. So it's just that even though they aren't facing those negative consequences because maybe the partner isn't reporting the perpetrator because of their substance use, or isn't reporting them for their physical behavior for whatever reason that they might be afraid or scared, it just continues in that situation. But it also results in shame, guilt, decreased self-esteem, because if you're if you're the victim in that situation and you're dependent on the substance, it's not as easy to reach out to friends and family and let them know that. First, it's hard just telling someone that you're being abused. It usually just doesn't happen hey, Patricia, I'm being abused. My fiance beats me every night. It's not that easy. Like, there might be reasons why me as a victim would not want to share that information. But add on top of that, that I am also a substance user and I'm being physically abused by my partner, it makes it way harder for this victim to try and seek those resources, because now I'm going to be afraid of being judged. It's like, I'm ashamed that I use substances while I have kids at home. So what are they going to think about me? So I'm not going to put myself in that situation. That's only adding even more to the situation. But we'll move forward here a little bit. And why would someone turn to substance use? And with our current events right now, where we have COVID-19 happening, and a lot of people have been affected to where they've lost their jobs, and they no longer have access to that income, that really affects some of the victims that could escape their perpetrator when their perpetrator would go to work, and they would have that 8, 10 hours a day where they were away from the perpetrator, or the perpetrator was no longer there. But with some of these situations, maybe we've seen some of these cases where perpetrators are now at home because they don't have a job. So the victim no longer has those 8 to 10 hours of freedom throughout the day where they don't have to put up with the perpetrator. Now they're stuck with them 24/7 on a daily basis, and that causes stressful situations. It frightens victims because they don't have that escape. So some might turn to substance use again to seek that escape, if only for a few hours. That might be one of the reasons. Trouble in their relationships, where maybe we're just tired of arguing with your spouse, with your significant other, and all of a sudden now it leads into, well, you know what? I'm just gonna go use some alcohol. I'm just gonna go drink a beer, and then it turns into every single night, to the point where I'm going to have 3 beers throughout the day, and it only keeps increasing, because again, we know the longer it goes on, the situation goes on, that substance use increases, just like the violence at home, the abuse at home. Um, but sometimes it's maybe just to relax. Maybe it was that stressful situation at home, and you know what? I'm not putting up with that verbal abuse today. I'm just gonna go sit in this section of the house, use some sort of substance just to relax, just to feel free from the negativity that's going around there. Um, Peer pressure. This is another one of the things that we hear a lot, but this is more when it comes to substance use and peer pressure. We see this in the abuse of medications. When we're talking about antidepressants and painkillers, we see that form of abuse when it comes to peer pressure. And the same thing with self-medication. When we talk about, well, how easy is it to have medications that you can abuse in your household? And when I went to get my wisdom teeth pulled, I remember I had all four of them pulled at the same time, and the dentist, he was going to prescribe me some painkillers, and he said, okay, I'm going to give you a month supply with an extra month's refill. And I'm thinking to myself, why on earth would I need 60 pills, 60 different painkillers, or not different, but 60 pills of this painkiller? Why? Like, there's something wrong here. So what would have happened? What would have happened in that situation if I were to go home and I managed to use what, maybe three pills for that week to help reduce that pain, and then just left those pills right there. In the medicine cabinet. I would let, like, if let's say I had family members living in my household, they have access to that medication now, and if they know that this worked for them before, because maybe they were themselves at dentist and they were prescribed something like a painkiller, and they know this can help them escape, that's where that substance abuse and the ease of using or getting their hands on that substance would come into play. So it's just different ways that we see that, um, or why someone would turn to some form of substance use. And here, I'm going to touch very briefly on these. These are just some the statistics when it comes to substance use and intimate partner violence. But intimate partner violence against female partners was 2 to 4 times higher among men with alcohol problems than among other men. 92% of men who assaulted their female partners had used substance on the day of the assault. So again, just to clear things up, does one cause the other? Does substance abuse cause domestic abuse? No, we know that's not the case. Just wanted to clear that up because the statistics do show that some form of substance use, like alcohol, was in the picture, but it doesn't mean that it was because of the alcohol that the substance abuse happened. Okay, so we know it's a choice when it comes to being abusive of your significant other or just a partner in general. It's a choice, it's a learned behavior, okay? But when the perpetrator, because we know we have the perpetrator, we have the victim. So if we have a perpetrator that is the substance abuser, we know that's dangerous. We know it can be dangerous because, for one, it does cloud their judgment. It might be that they're taking some sort of LSD, they're taking some sort of hallucinogen that makes them become paranoid, and then any little thing their partner might say might set them off. So that just adds on some just unneeded levels of stress to the environment that can set that perpetrator off, where it can cause them to become physical because they think that their partner is the one that's trying to assault them or being the aggressor in the situation. It just makes them paranoid in that situation, and that only worsens things. But if somebody is in their high and they become physically aggressive towards their significant other, they might not realize how physically aggressive they're being, or they might not be able to realize how much damage they're really inflicting into their perpetrator, which can cause, again, some severe damage, because they might not think, okay, just because I'm punching you, it might not be that hard, when in reality the victim going through it is suffering from fractures, or it's just leading on to even more physical damage. So just always, when the perpetrator is that substance user, it just causes so much harm towards the victim in the form of that physical abuse, just because they don't know how much damage they're inflicting in that situation. And because last but not least, it's used to as an excuse again. It was that pill that made me that aggressive. It was that alcohol that made me aggressive. That's not me. I would never do something like that. And it's always used as that excuse for the behavior that they were just or resulted as from it. But what does that cycle look like from a perpetrator's standpoint? They use the substance of choice. They abuse their partner. They accuse again that substance of being the one that makes them violent, and then they apologize. I'm so sorry. It's never going to happen again. That's not me. And then the cycle continues over and over again. and that's how we see that form of abuse when it comes to the perpetrator. But why does the perpetrator stay? I mean, when it comes down to it, it's that power and control dynamic. They're getting what they want. They're seeing that it's working. Being physically aggressive gets results for the perpetrator. If the victim isn't doing what they want, but then all of a sudden they start pulling them here and there, they grab them by the hair, and the victim all of a sudden, okay, it's okay, yes, I'm gonna do it. Just stop, just stop. They see that it's working for them, and perpetrators love having that power and control over their victim. When it comes down to it, they get to control the money. Maybe they're the ones that lost their job due to COVID-19, and now their significant other is the one that's working. And when they come back, they're going to be the ones. The perpetrator takes that money that they've made, and they get to dictate how that money is going to be spent, or they use that as their own personal source of income instead of allowing that victim to use their own money, where it becomes now it becomes a form of financial abuse in situations like that. And then at the same time, perpetrators like to victim blame. They like to blame the victims, that they're responsible for the abuse that they're suffering through. That it's their fault, that they somehow caused this abuse. So being able to use that, who is going to believe you, especially when if the victim is a substance user, how would that situation look? You're going to call the cops? Okay, go ahead and call the cops. Who are they going to believe, me or you, the junkie? So it keeps them from it keeps the victim from wanting to report the perpetrator. Fear, because of that fear of, okay, I don't want the police to arrest me when they find out I'm the substance user. But the perpetrators use that in to their advantage, using those form of victim blaming, or using that who's going to believe you in that situation. And when the victim is the substance user, one of the harmful things that comes out of it is they're not able to, again, it does cloud their judgments. They might think, hey, I can fight this individual off, I can keep them off me, and not realize how much danger they might really be in. They just think their situation isn't as bad as it really is. So again, it just clouds their judgment. If they had a safety plan set up where, hey, this is where I'm going to go, this is who I'm going to call, this is where I'm going to stay, I'm going to take all the documents with me that I had listed with me, they're not going to be able to really initiate that plan that they've set up for themselves when their judgment has been clouded like that. So it becomes harder for a victim to get themselves out of a situation, even when they've already planned for this situation ahead of time with their safety plan or with their recovery plan in hand. But again, parents, especially like mothers, they love their children. They want to make sure that they can keep their children safe. And again, this impairs that ability, because when someone's using those substances, they're not going to be able to properly defend the children if they're the ones that the perpetrator is trying to go for. That just because the perpetrator, or the victim in this case, isn't fully there because they're incoherent because of that substance use, and they might use the children against the victim. In those situations, they're not going to be able to properly defend the children in that case, in those kind of cases. And again, it makes that victim reluctant to seek those services because they're afraid that they're going to be the ones that are in trouble in that situation. Because how am I going to call CPS, or how am I going to call the cops, or how am I going to call this substance or this domestic violence agency to help me when I'm the one using substances, when I'm the one that's high right now? How is that going to help me? And it causes that fear, again, that makes them not want to go out there and seek those resources because they have that substance abuse problem. So it becomes really hard for a victim when they are the substance user as well, to escape their perpetrator or leave that situation behind them. And what might that cycle look like? In situations, again, they become abused by their partner, so now they want to escape. So they turn to their substance abuse. They turn to some sort of substance to help them get out of their situation, because that is their coping mechanism. And then after they come back, the drug has left their system. the incident is forgotten or ignored, or they've been apologized to, so they forgive the abuser. And then if there's no reporting of the incident, if there's no documentation, police weren't called, that cycle is just going to continue to happen again. Because again, in the perpetrator's eyes, they're saying, okay, well, this victim, my significant other, isn't reporting me. They're not going anywhere. So it's clearly working. That power and control dynamic is working for the perpetrator. So it's going to continue, just like that that abuse, that substance use as well. But why would a victim stay in such an abusive situation? We've already talked about it briefly here and there, but we know that fear is one of those reasons why a victim would stay. If the victim doesn't have those resources, if a victim is afraid of being judged because of their substance use, why would they leave that situation? They don't want to leave situations like that. Maybe they've been threatened by their perpetrator, telling them, if you leave this situation, I'm going to kill you. I'm gonna make sure you're dead. If they're being threatened and being told you're going to lose your life, why would they leave that situation? That fear comes into play that keeps them in that situation. It might be a disability. Their perpetrator might be the only one that's working, and the victim might also be diabetic or in a wheelchair, and they're on their abuser's insurance. This is how they're getting their insulin for their diabetes. And why would I want to leave that situation when the reality of it is the moment I leave there, I have to pay for all that out of pocket, and I don't have money for that. It keeps that victim in those situations, not because of choice, but just because they have no other choice. They what else can they do? That's how they feel. They feel as if they don't have a choice when we know they do. We know there's agencies, again, like ours, that help individuals get themselves out of situations like that. And the other one I want to touch on briefly here was the immigration status. I did a I did a presentation for a parent group. It was a Spanish presentation for this for parent group, and I touched on immigration status. I had it up there, but then I had my chat just get flooded with immigration questions. It's like, hey, if we seek services at an agency, like at your agency, are we required to prove that we're here legally? Are you going to call ICE? Are you going to call immigration if we're not here legally? Because we know a lot of people are scared to seek those resources because they think we're going to report their status here in the U.S. to immigration. We know that's not the case, but we know we're not, our agency doesn't do that. We don't do that for victims, so that's not what we're worried about. We're just here worried about their safety. We want to get them out of their abusive situations. But perpetrators use that to threaten a lot of victims to keep them in that situation. Oh yeah, you leave, you're going to leave me? Well, don't worry, I'm going to report you. I'm going to make sure you get deported. You go back home, wherever that may be. So I had to let them know, yeah, we're not here to worry about where you should be, if you're here legally or anything. And it was one of those things when it comes to when it comes to the victim, that they have been essentially lied to by their perpetrators, being told that, yeah, when you seek help, you're going to be deported, or I'm going to make sure you get deported. And we know that's that fear again that comes into play, that they don't want to get deported, and we know we don't want them to have to go through that and deal with that situation. So again, I really wanted to touch on that one as well. But there's many reasons there, as you can see, why a victim would stay in that situation. And I want to touch also on pregnancy when it comes to substance use, when it comes to that domestic violence, and essentially the harms that can come out of it. Because some mothers or not mothers, but some females in those relationships tend to think that if I get pregnant and there's a kid now in the picture, that's somehow going to stop the abuse. And we know that's not true. We know that when it comes to a pregnancy, if it might make things worse for the victim, because the perpetrator is now losing that power and control over that victim, because now they're caring about their well-being of their unborn child. They're focusing on that instead of the perpetrator, and the perpetrator doesn't like that. So it can escalate situations to where the perpetrator is going to try and do anything they can to get their hands on that power and control again. If it's okay, maybe in situations like that we've seen harm can come to babies when it comes to substance use. It can turn the victim into knowing that, because victims are smart when it comes to getting their way in that situation. And if they know that the victim has used substances before and they have had a dependency before, they might escalate to those levels to get their significant other abused or cause them to relapse during that pregnancy to regain that power and control, which again has even more risk attached to that. Like I have listed right here, different birth defects, the fetal injuries, miscarriages. So when you mix all three, this is like worst case scenario when we're talking about substance use, when we're talking about domestic violence. When you add that pregnancy and the mother is the substance user, that only just is like adding fuel to the fire. So it's just one of those situations that we want others to know as well, that just because pregnancy is in the talks, it doesn't mean that the abuse is going to stop in situations. And again, we have the 6 forms of abuse, and we see that here in the form of physical abuse, emotional abuse, sexual, verbal, financial, and digital. And the more common ones are that physical abuse that we all know what that looks like. It's that kicking, punching, screaming. And what that might look like when substance abuse comes into play, it might be by forcing a withdrawal of their victim. I know you're dependent on this substance. I'm going to take it out of the picture so you can go through withdrawal symptoms, and so you can go through those physical pains, so you can go and feel like your bones are breaking, those kind of situations. So that when substance abuse comes into play, it can be victim can go through different forms of physical abuse involving substances as well. The same thing with emotional abuse. In this, we see name calling someone, shaming someone, or destroying someone's property that they work so hard for. And the way we see that emotional abuse when it comes to substance use is not threatening them, but using those terms, those derogative terms, like, "Well, who's going to believe a junkie when you call a police officer? Who's going to believe you in that situation?" Sexual abuse, we know what this looks like, and a lot of people usually jump to, well, this is what sexual assault looks like, this is what rape, and we know there's many different different forms of sexual abuse or what that might look like. But the way we see that when it comes to when substance abuse is in the picture is they might force their partner to exchange some sort of sexual activity for those substances that they might need, even if the victim isn't the one that's using those substances, but the perpetrator needs that substance. They're going to force their partner to do those sexual activities for exchange of that substance. So that's another way we see that form of abuse. Verbal, again, we know what this looks like, those different terms: you're a crackhead, you're a junkie, you're dumb, stupid, ugly, and chipping away at that self-esteem, which can be harmful, because when we're chipping away at victim self-esteem, it doesn't make them feel good about themselves. They're not going to want to be out in public where others can help them. They're going to become mostly isolated in that, and so it plays against them, and them wanting to seek services just because they don't feel good about themselves. Why would they be out in public in that situations like that when the perpetrator has made them feel like they're worthless or they're useless in situations like that? So we know that verbal and emotional abuse can be very harmful. We've seen situations where survivors have left their perpetrators years now, but when they're out shopping, they're at the self-checkout and they see that candy bar and they pick it up, all they think about is their abuser back in the day that used to call them ugly. It's like, why are you coming home with desserts? You need to lose weight. Uh, so they think about that years later after they've left that situation, and they put that candy bar down, because again, it sticks with these survivors after they've left their situation. So when we talk with them, they tell us that emotional abuse is probably one of the hardest things to ever overcome, because that physical abuse, those broken bones, those bruises, all of that heals over time. But that emotional abuse really sticks with the victims and the survivors. And then financial abuse, this is again one of those that maybe they're not allowed to work because the perpetrator is afraid. The victim has money, they're going to be able to put gas in the car. They're going to be able to drive one state over and find a hotel away from the perpetrator, and the perpetrator doesn't want that. What does that look like when substance abuse comes into play? Again, maybe like we've seen situations where the abuser is the dealer, is the one supplying the substance to their victim, and so they're supplying their substance to them. When the victim can't pay, doesn't have money for that situation, they're they're going to essentially try and use that as a form of financial abuse towards them, because maybe it'll turn it into some sort of sexual abuse because they don't have the income to pay for that, so they're going to ask for some sort of sexual favor in that way. So that lack of income can really affect that relationship when situations like that come into play. But then we also have digital abuse. We're living nowadays where everybody has access to some sort of digital device, whether it be a cell phone, a tablet, computer, a laptop. And we see all forms of abuse happening nowadays, where it comes to using GPS trackers to track someone, or getting into their phone and using different sort of software to track their text messages, their phone calls, their pictures. So when it comes to that form of digital abuse, it might be a situation where the perpetrator has recorded the victim using some sort of substance, and they're using that to blackmail them, to keep them again in that situation, to give the victim another, forcing the victim again to stay in that abusive situation. So we see those different forms of digital abuse. And we've talked, like I've brought up power and control. I've talked about that. And again, when it comes to a perpetrator, they want that power and control. This is what they want when it comes to those relationships. They'll do what they can to get their hands on that power and control. If it has to be isolating an individual, when it comes to telling them who you can hang out with, who you can't hang out with, or keeping them away from family members, friends that can link them to some sort of resource, to an agency that'll help them get them out of the situation. They don't want any of that. So isolating their individuals, again, that's one way that a perpetrator can gain that power and control over their individual. Coercion and threats, letting them know, I'm going to physically, like, I'm going to hurt you if you leave this situation. If you attempt to leave me, I'm going to hurt you. So just upright threatening the individual in that case, another form that power and control comes into play, or how the perpetrator is using it, using their children against them as well. And in that situation, again, when I was at that facility, that substance facility, and we were talking about that, we had different individuals mention children, mention CPS. So we know that there have been abusers that threaten their victims when it comes to, yeah, well, you're using these substances, so I dare you to call CPS. Who do you think's going to get custody of those kids? So again, it's using those tactics that the perpetrator uses to gain that power and control over an individual. And I saw this quote that I really liked in the National Center of Domestic Violence and Trauma and Mental Health in their website that I saw, and it goes, "The drugs are an element of control. If they can keep you on the drugs, using or addicted to the drugs, they're in control, and it's like strings on a puppet. They just keep you under control because you want that other hit, you want that other drink." And again, when it comes to perpetrators, they are smart with the tactics that they use against their victims. And if they know that their partner, the victim, is susceptible to a relapse, they're going to use that. If that's the only way I can get that power and control over this individual, then that perpetrator is going to use that tactic. They're going to use whatever they can so they can regain that power and control. Because again, that's the number one thing that matters for a perpetrator. If I get them to do what I want them to do, that's me having that power and control. And if I have to use that substance to get it, they gave that perpetrator no other choice. So they're going to take advantage of that, take advantage of their substance use dependency in that situation. And let me check chat real quick. I know I've been talking for quite some time, so let me see if anything popped up real quick. Okay, I think we're okay right now. But when it comes to these misconceptions that we hear that it's anger that caused someone to be aggressive, we know it's not an anger control, anger management issue. We know it's not an intoxication issue. We know it's not genetics, because people aren't born being abusive. Again, it's a learned behavior. When children grow up, it makes them susceptible to becoming either perpetrators or victims. In those cases, I mean, it might be stress that's used as an excuse. We know that there are plenty of stressful situations, but that doesn't make people abusive. So that's just more of another excuse that's being used. We touched on loss of control again. We know DB that domestic violence is a choice. Abusing someone is a choice when it comes to those situations. But what can we do to help someone that is in need, that might be going through that situation, those situations that we talked about? One of the best things we can do for someone is just believe them. Believe their story, no matter how crazy it might sound. Victims aren't making these stories up just for attention. They're going through those situations. They know their situation better than we do. So once a victim comes into our facility, the first thing we're going to do is believe them in that situation, and that's the best thing you can do for someone that reaches out to you, because the moment they realize that, hey, my friend here that I reached out to believes me, I'm going to make sure to come back to them when I'm ready to get myself out of the situation, because they might be able to link me with some sort of resource. So it opens that door for them to seek resources, because they are seeing that someone out there really does care about what they're saying, and they weren't written off completely. So believing them, being supportive, um, and we see that in different forms. Hey, if you ever need something, just let me know. I can find some shelters for you. I can find agencies that help with the sort of issues that you're going through. So let me help you in that situation. Being supportive with them, staying in touch is another really important one, because again, the perpetrators want to isolate their victims. They want them to lose that support system. They want them to lose those friends that might link them to that agency that can help them develop that safety plan. So when we stay in touch with them, it lets them know again, hey, somebody does care about me. So when they're good and ready, they're more likely to reach out to you, so you can help with any resources that you might have to offer for them. So and it keeps them from becoming isolated. Again, that only benefits the perpetrator in that situation. Validate their feelings, let them know that nothing that they ever did warrants the type of abuse that they're going through. There's no that it's never their fault. Again, never never make them blame in those situations. We see many well-intentioned errors when it might be, or when we hear, my partner abused me last night at the party, and then somebody comes up to them and tells them, well, how much were you drinking? That's not what we want to tell a victim, because now we've made them feel like it's their fault, because if they weren't drinking as much, they would have been sexually assaulted that night. So we need to just validate their feelings, and be very careful when it comes to not blaming them for the outcome uh, of whatever happened to them, and offer resources. If it's even one agency that you might know, and it's just our agency, Hope Store New Beginning Center, that might be enough for them. And again, there's plenty of other agencies here in the DFW area. We're not in competition with one another. We're trying to help each other. We're trying to help all of these victims going through some form of abuse. We're just trying to help them in that situation. So it's, if you're able to find those resources. I have some more towards the end. I have a few resources that we can offer, that you can help offer an individual that might reach out in that situation. But what might some of these warning signs look like? Some of the more obvious ones would be those bruises, those black eyes, that excessive makeup that they might be using to cover up. Maybe right now during summer they're using those turtlenecks, which is that clothing that isn't fit for the weather, because they might be trying to cover up those strangle marks around their neck. There are situations like that. Busted lips, that low self-esteem, when maybe you know that your friend was always getting their hair done, they were always taking care of their appearance, and now all of a sudden they no longer care what they look like. Granted, we are going through COVID-19 right now, and I mean, a lot of people are just at home with their PJs and they join the Zoom meeting. I get it, but if you are hanging out with this individual and you see that they're not taking care of themselves like they used to, that might be one of those warning signs. Again, that might indicate that there's something going on. And one of the other things that we can do for those individuals is ask questions. Ask them, hey, is there something going on? Is there something you want to talk about that maybe you haven't mentioned? And maybe it might be nothing, but it's better that you ask and put it out there, because again, if they are going through something and you brought up that concern, it lets them know, hey, my friend Jose here clearly cares about me. So when I'm good and ready, I'm gonna make sure to reach out to him and let him know that, yeah, I am going through something. Like, is there something you can do to help me in that situation? So that's what we want to. That's what we want to give these victims, that glimmer of hope that there's someone out there that actually cares about their well-being, that actually wants to get them out of that situation that they're going through. And if all I can do for them is give them that resource, that hey, there's that agency, Hope Store New Beginning Center, that helps victims, and they have these free services for them, that alone there will help them in that situation. It'll be more than enough to help get that ball rolling, and help them through that situation that they might be going through. And what might it look like in a relationship? What might that abuse look like in there? We have again, isolates you being one of the more common ones, demonstrating ownership of you. Like, I get to tell you what to do. It's no longer a two-way street. So that relationship dynamic, because in a healthy relationship we see that there's proper communication. We're trying to resolve issues together. But now if I'm dictating to you, I'm telling you everything you should do, I'm telling you you're responsible for every hardship that we're going through, that's when we start seeing that the control trying to manifest itself. We're seeing that those early signs that a perpetrator is trying to gain that power and control over an individual. Um, Refuses to let you work, or just trying to keep you again isolated. They don't want you to have any sort of resources. They don't want you to have any sort of financial income, so you can leave this relationship or escape it. They're trying to keep you isolated in that situation. So I have quite a few listed up here. You can look through real quick. But when it comes to helping others, there's plenty of things that we can do. There's plenty of things that we shouldn't do. So again, blaming the victim, when it comes to that victim blaming, that's something we don't want to do. So instead, what we want to do in that situation is just take the time to listen. Don't jump in and telling them this is what you need to do to fix your situation. Let them tell you what they're going through. If they've chosen to actually speak about the situation that they're going through, just give them the time to open up and share what they're going through, and just take that time to listen. Again, listen, believe them, and offer those resources when it comes down to it. But don't make it about yourself. When they tell you if the partner's been physically aggressive every single weekend, don't turn around and tell them, if that was me, I would have left 2 weekends ago. Don't make it about yourself. Don't make them feel guilty in that situation. Again, let them know it's just not their fault. Respect their choice, because they're the ones that know that their situation better than you do. I never put myself like pretend that I know better than a victim, that I know their situation better than they do, because again, I don't know if they're sharing every bit of information with me, and I'm not gonna hold that against them, because again, it's not easy to speak to someone when it comes to this topic or what they might be going through. So again, just listen, take the time to believe their story and validate their feelings when it comes to that, and be patient with them as well when it comes to situations of them constantly reaching out to you, because it might not be the first time that they reach out to you that they're ready to seek those resources or get themselves out of that situation. It might take a few times of constantly leaving and coming back and leaving and coming back before they're finally tired and they're fed up with all this abuse. So just be patient with them, be there for them in those situations. So when it comes down to that abuse, what can someone do if they are in that immediate danger? Just call 911 in that situation. Like, get that help that you need then and there, especially if you're fearing for your life. Call 911 in those situations. Um, Leaving doesn't always guarantee that someone is going to be safe. And studies have shown that in those first 2 years, those are probably the most dangerous for a victim once they've left their abuser, because that abuser has lost all power and control over their victim. So again, we like I've mentioned this before, but that perpetrator, that abuser wants that power and control. So they're gonna do anything they can to regain that power and control. So those first 2 years are the highest where the victim might actually lose their life to that perpetrator. Those first 2 years. So we never tell a victim, just break up with him, just leave, just get out of there, because we know the dangers that come with that. And I mean, we have relationship violence is a crime. Like, often it just gets blown off as like, oh, he just hit me one time, or this was the first time they were physically aggressive, but they've been financially abused before, emotionally abused, verbally abused, but it's just that first time, that one time they became physically aggressive. Like, that is a crime. We know that, okay? Um, Abuse isn't caused by that. Intoxication isn't an anger management issue again, and it's never the victim's fault. They're never responsible for that, for the abuse. Again, it's never, it's, we never want to blame the victim for the abuse that they might be going through. And they're the experts in their own, the situation that they might be going through. Again, we're, as an agency, we're just here to help them with the resources that they might need, but only they know the situation that they're really in and how dangerous it might be, or it is rather. And when it comes to that substance use, when it comes and that domestic violence, domestic abuse that they might be going through, we have that safety plan, but we also know that there has to be a recovery plan if the perpetrator or if the victim is the one that is using that substance or has that substance abuse dependency. And what might a safety plan look like? Now, this is just more like a cookie cutter safety plan, and these safety plans are more specialized for each victim. And there's plenty of resources out there. If you type up safety plan, you can see many like basic list of what you would need, what a simple safety plan would look like. But these are always best done with professionals, professional counselors that can help you with that situation, where you can specifically set a safety plan for your needs, for a victim that might be going through and what they might really need. So just personalizing that safety plan is always a good thing, but a safety plan, a small little safety plan, can be done ahead of time. And it'd be like documenting, taking pictures of important documents. So maybe they've been abusive by a cell phone. They send those text messages. They threaten through a text message. Take screenshot of those, save them. Maybe it's voicemails. Save those voicemails. If it's they're being threatened by email, again, just keep a copy of that evidence of those forms of abuse. Just keep documentation about that. If you've been in and out of the hospitals because on certain days or whenever, just write down the dates, make documentation of that, so you can cross-reference when this is when he was physically aggressive and I had to go to the ER. You have proper documentations when maybe now you're ready to reach out to police officers. this is information you can use in that situation as well. Um, Setting money aside as well. And when it comes to the perpetrators again, if they're controlling the financial situation, they're going to know where a perpetrator is trying to hide their, or where a victim is trying to hide their money. So maybe having having money that they've set aside at a family member's house, or just away from their home where the perpetrator can have access to it or find it, would be another way that we could see safety planning. But finding resources, where am I going to go, like where am I going to stay, who am I going to reach out to, what other shelters are there, like having a list of that as well, another very basic form of safety planning. And if that victim is also that substance user, we see that there's a different dynamic when it comes to a safety plan and a recovery plan. Depending on what substance use the victim is using, there might be things like naloxone that come into play, because if they're using heroin, cocaine, those type of things, those substances that would cause an overdose, a recovery plan needs to be personalized to involve that naloxone kit in case of an overdose. But being able to identify goals, tracking progress, and when it comes to seeking resources, we see that in ways to find other facilities, like substance abuse facilities in your area, and being able to write down telephone numbers for maybe AA groups, and writing down that information, having that readily available, is what we see when it comes to recovery plan. But when it comes to a victim, they're always the professional in the situation that they're going through. We, as friends, family members, advocates, we want to work with them to help get them out of the situation that they might be going through. We don't ever or want to think to ourselves that we know more than they do of their own well-being. So the best thing we can do is offer those resources to the victims, things that they might need. I talked I talked briefly about digital abuse, but we have a few applications that are out there that you can help a victim when it comes to being digital abuse. It's the one on the top right called Tech Safety App. So this helps with very basic information that you might not think about on a day to day, but it helps them how to navigate their way through some form of abuse that they might be going through, and it gives some different options that they can use to help get themselves out of the situation, or how do I handle this digital abuse? How do I block someone? How do I make sure they're not tracking my social media sites, or give them information to where they can download pictures and track my exact location? It helps with different aspects when it comes to that. But I have life path systems. I have Homeward Bound, and I have Metro Care Services. These are different organizations here in the DFW area that help individuals going through some sort of substance use dependency, and and we're trying to work more with these agencies so we can have them link these individuals to agencies when they see signs of domestic abuse. We're trying to work and make a connection there when it comes to that, so we can all start working together in that aspect. I have Dallas County Health and Human Services as well, and I have Recovery Resource Council, which are other agencies that I've worked close hand in hand with, that do offer those services for the victims, that do offer testing when it comes to situations where it might be sexual abuse that came into play, and the victim has been sexually assaulted by their partner numerous times, and they need to get tested for some sort of STI. They help in situations like that as well, and it helps they link them with other organizations depending on their needs and what they might be going through as well. And that pretty much brings me to the end of the presentation. And I do have actually forgot to mention that I do have a poll at the end right now, which is, it should pop up here in a second for you. And this helps This helps us when it comes to reporting the number of individuals we reached out, just to help us when it comes to funding and all that, letting them know we're out here doing our job, educating the public. But if you found this is all anonymous. If you found any other information, please answer honestly. This helps us as an agency, as presenters, as educators, and everything. It helps us grow, helps us see what works, what doesn't work. So please feel free to answer that, to help us out. And I have my contact information up here for anyone that maybe you want to have us speak out at one of your events, at your church group, somewhere that you feel like this might be valuable information. If you check our website as well, I actually don't have that up there, but it's hdnbc.org. You can go through our education tab, where we have a number of lists where different topics that we can talk about, we can present on, but we can also customize different presentations to fit the needs that you might need. But all that information is up there, and please feel free to reach out. Again, thank you everyone so much for joining me today. And
thank you for supporting survivors of abuse in our community. Education is the key to prevention. If you found this webinar valuable, please share it with your social and business networks. For information on upcoming webinars, please visit hdnbc.org/webinars, or from our homepage, click Webinars under the Get Educated tab. And check out the HDNBC Community Education page at hdnbc.org/get-educated for more information on school presentations, live trainings, Zoom webinars, and our other educational programs for community organizations, businesses, first responders, youth groups, and more. There you can submit a request for one of our educators to speak to your group. As a trauma-informed agency, we are accepting and affirming of all members of our community. We serve women, men, non-binary individuals, adolescents, teens, and all members of the LGBTQ+ community. If a survivor reaches out to you, try to remain supportive and non-judgmental. Let them know you believe them and want to hear their story. Let them know you care about them and are concerned for their safety. Maintain contact with them. Emphasize that abuse is never okay, they are not alone, and it is not their fault. Tell them to call 911 if they are in physical danger. Tell them that free help is available. Hope Store New Beginning Center's 24-hour hotline at 972-276-0057. Our trauma-informed services are for anyone who has been affected by domestic abuse, including our 24-hour hotline, 972-276-0057, 24-hour emergency shelters, individual and group counseling for adults and children, legal support, case management, transitional housing, community education, and our battering intervention and prevention program. We also have volunteer opportunities available. And don't forget about Hope Store Resale Store in Plano. All proceeds from the resale store help to fund our free services. For more information or to ask a question, please call our main office line at 972-422-2911. Check out our website at hdnbc.org or send an email to info@hdnbc.org. Hope Store New Beginning Center, building lives without violence.